Good morning, welcome to Eyeris Eye Care. What I am going to talk here is regarding the normal process of the surgery in our hospital. So let me tell you the first thing that every hospital, every surgeon has got his or her own way of dealing with his patients and conducting the entire process for the surgery. So when I say that the surgery happens like this is the precautions needed, this is the aftercare, it may not be applicable for all of you because I may not be your surgeon. So whenever you listen to any of these videos, I want to give you a disclaimer that every surgeon is an independent artist in his own level. So starting with that, let me tell you that I'm an eye doctor. So when I say an eye doctor, I deal with all the treatment of diseases, surgeries, particularly only to the eye. Most of the eye surgeries are carried out on daycare basis, where you don't need to get admitted. So you walk into the hospital, get your eye surgery done, and you can walk out of the hospital on the same day. In most cases, you will have your breakfast at home, and after the surgery, you might even have a lunch at home. So that's how fast advanced the technology has gone. So I'll take you to the process of a normal, basic, most common surgery in our setup, which is a cataract surgery. So a cataract is not a disease. It's a normal process of aging. Just like graying of hair, a cataract can come. You have a cataract, I will get a cataract. Your kids will get a cataract in their own time. So cataract is not a disease, it's just a process. So the idea is the surgery for cataract is supposed to be an experience rather than a torture. Okay? So in our hospital, what we follow is the patient reaches our hospital for the surgery after taking a good head bath at around 10 o'clock in the morning. Once the patient comes to us, the patient is already been told to take all his or her systemic medications just like every day. There are no medicines in systemic conditions that need to be stopped because of a cataract surgery. Once the patient arrives, the patient signs a basic consent form for the surgery, does the essential documentation at our center. This is a 10-minute process. Once this entire process is done, the patient is taken to a pre-op area where we start putting some eye drops for the patient. These eye drops are essentially to open up the eye, that is, open up the pupil, that gives a surgeon like me a more better area to work with. Once your eye is sufficiently dilated, we will take you to the operating theatre. So the operating theatre, we don't use injections for anesthesia, we use eye drops for anesthesia. Now, eye drops for anesthesia is applicable for most of the cases, but in some cases, we use injections for anesthesia even today. It's unavoidable. So if you are for an eye drop anesthesia surgery, the only thing we expect you to do in the operating theatre is just look at the bright light which you see in front of you. Keep your hands to the side, don't move, relax. If you have any difficulty, you can speak to me. I'll be actively talking to you during the surgery. Any problems, you can always tell me. Okay? The surgery in total takes around 15 to 20 minutes. We try not to rush the surgery. If your surgery requires half an hour, I'll give it to that. If your surgery requires more patience, care, and it might take 40 minutes, let it be. The idea is that we are not raising against time. We are raising for a better quality of vision for you and for your future. So during the surgery, you will see that this bright light on top of you might dull, dim, blur, or you will find a lot of movements in that. You need not worry. That's my instruments doing their job. You will hear some background noise from the machines that we use during the surgery. Once the surgery is done, we will tell you how to get up and where to sit. We will give you a protective eyeglasses, few eye drops. Now, after the surgery, we will be keeping you here for around an hour, just so that we can explain to you the process, we can explain to you the medicines, we can just see you that you're fine, there is no pain. Once you're comfortable, we will prepare your documentations and dispatch you home. Once you reach home, you just need to use the eye drops as advised. Beyond that, all the precautions and requirements are explained to you but multiple times a month. In case of any doubt, there is a helpline which is available.